good evening or good afternoon, I don't know what to say, but anyway, both for each and everybody who is present in this hall. So I'm Dr. Sreejith. I'm a consultant pediatrician as well as head of quality of SK Hospital, Trivandrum. I'm an NABH assessor since 2018. My topic today is myths and realities of accreditation. Nowadays, the term myth is going around in the political circle, and I'm happy to present you some myths regarding or realities regarding this accreditation processes. So I have only 2-3 slides. We'll discuss after the 10 minutes talk. So interaction is a key in this particular topic. So now we have something like NABH, you have a JCI. So whether both are needed or any one is enough, both are equally qualified to be projected at the international level, that's some questions which every HCO will be having or healthcare organization will be having in their mind. So JCI is having its own importance, NABH is having its own importance. Nowadays in our India, the majority of the people go for, majority of the healthcare organization go for NABH. So NABH is equally accredited to International Society of Healthcare. So it is also an international accreditation. So don't worry that we have only NABH and others have JCI. So we have to be at par or we have to increase our standards. Whatever accreditation you have, you should stick on with the quality which you are, that bar of quality which you are supposed to raise year by year. Now, what about the waste of money, time, and manpower, which is very much needed in our healthcare system? See, for any process or any achievement, you need these three things: time, money, and manpower. So what my humble suggestion is, it is always better to spend some time, some money, some manpower, because any of these three in your journey for an HCO, if you compromise with little bit, that will every time cause you lose more manpower, lose more money, and lose more time. So you might have observed any negligence or anything cost you lot if you would have stuck with the quality which you are maintaining. For example, in an equipment, say a lift, in any accreditation system, your preventive and maintenance system is having utmost importance. If you stick on with that, so what is happening is the proper proper, whatever things we do in this equipment, especially lift, everything will be done properly, and you don't have to worry. So if somebody is stuck in a lift, it is the name of the HCO is gone, the money you spend is gone, the manpower you spend has to be increased. So you can all avoid by simply sticking to this accreditation process, improving the quality, and spend some time, money, and manpower. So another thing is that each HCO is having different consultants, different ethics, different policies. What we have observed as a consultant or as a quality man, so whenever we go for the policies, what I observe is, suppose an ex-hospital, if you go through their policy, that will be all copy-pasted. Some institutions' policy, just for a namesake of making policy, they might have stuck it. So what you people have to understand is, your hospital is different. Our each finger is having different size and different length. So like that, each hospital policy you should make in your own way in which it suits for each and every organization. Please do it for your sake, your quality. Don't ever copy paste, and it will be very bad. Then another thing is, NABH assessors will come and go. So see, if ഞാൻ അത്ര ഒരു പേടി ഉള്ള എന്നെ കണ്ടിട്ട് അത്ര ഒരു പേടി തോന്നുന്നുണ്ടോ? ഇതുപോലെ തന്നെയാണ് എല്ലാവരും. So whenever an assessor goes, please think they are all human beings, nothing is going to lose because you are inviting them. It is nothing like inspection. Please try to understand. NABH is not an inspection, it's an assessment. You are inviting them to your institutions with your own purpose of improving the quality, and we are just coming here not to find fault. It is for the finding the truth. That's all. How that will give you an insight what is lacking, what bridge has to be connected in your organization so that you can improve a lot in your organization. So don't think that it's a fault finding mission, it's a fact finding mission. And this particular assessor who comes to your organization has only one right to submit his observation to NABH Secretariat. No assessor can give an organization a recommendation not to give. He has to only just go with a mirror, go to your places, show the mirror to you, this is what you are, and we are reporting that. That's all. The end whatever thing is been taken by NABH Secretariat. So that assessor is not a god. He is just taking a mirror and coming along with you to show you and to just find the fact about your institution. That's all. And treating an assessor, nothing goes anywhere. It's for your purpose. Please understand. So anybody who has gone with that assessment, you might have seen there is something called quality improvement. For that, there is a CQI, quality indicators. See, in our, where I am working as a head of the quality in SK Hospital, what we do is, every month, including our CEO, will come, sit with us, all the stakeholders, that is for operation theaters, anesthetists will come, like that, the stakeholders come and sit, and the 33 quality indicators will be presented by the stakeholders, and the delegate approach, and diligently we will just scrutinize what is happening, not to hurt them, not to find some fault in them, just to improve the quality as a team. So this particular CQI, which accredited hospitals do have, please don't do it for one day, please do it for the organization in every month and present it. And one thing I just want to assure you is, see, even when there is an assessment on your hospital, doesn't mean that they are somebody from MCI, they are from the government, so what they will feel bad, nothing they will feel bad. If you present the correct data, everybody is happy. That means you are working hard. If you just present some data which is a hoax, anybody can find it out. And that doesn't make good sense or doesn't make any good for your organization. So please present the original one. 1%, 2%, anyway, you will be adding something and also nobody bothers, but it should not be a hoax call. Thank you. And an NABH assessor, when the myths is, whatever he tell, you have to listen, nothing like that. See, there is a guidebook given for each and every HCU. Each objective elements, now like I have just finished 70 odd assessment, pan-India of NABH. Still, whenever I read that objective element, new things I'm just finding it out. For example, in one objective element, COP, somewhere it is written that the organization may have some equipments or something which is child friendly. For example, play area or breastfeeding, the room, something like that. For that, the management or the quality people in that hospital will try to build a play area. Somebody will try to build something like breastfeeding area. Nothing like that. It's an example given there. A simple toy in front of the pediatrician's table is more than enough to cover that COP. For that, if an assessor comes and tells you, where is your breastfeeding, the chamber, or where is your play area? Yeah, you can tell him, sir, this is not there in that guidebook. Say something in the guidebook. Yes, you can always tell, but Bible of assessment in NABH is the guidebook. Stick on with that guidebook. Each sentence written, go through it. Each para, go through it. You will find the real fact in it. Stick on with that. Nobody can challenge you. That's a fact. Anything outside that objective elements given that test book, they just can't write anything against it's you. So as I told, so anything, assessors are rude, poor communication skills, no diplomacy, nothing like that. See, you can't find me so much harsh, right? I'm a simple man like that. So each person will be having its own identity. It doesn't mean that the people coming as an assessor are rude or something like that. Nothing like that. We are also human beings. We want, NABH want each and everybody, just they are there to handhold you to improve the quality standards in your institution. You all already have those things, but just to have a little bit one step forward. That's all NABH needs. Why spending so much on training? Hospital infection control, quality, staffing, especially nursing. See, let me tell you, it's so many ladies are there, so many nurses may be there, but to be frank, nurses, there is a lot of shortage, not even in Kerala, in whole India, I could say. So wherever I go, there is a shortage of nursing. The worst part is, those who study nursing colleges, those institutions having nursing college, their students themselves won't continue in that college. They may be going somewhere else. See, stick on with the Indian Nursing Council thing. That is 1:1 for ventilator, 1:2 in ICU, 1:4 or 1:6 in wards. That can be done in acuity based and according to the operation beds and daily census. So if you do that, really you need not worry about that. But as a statutory, it is very much needed that we should have some minimum amount of the nurses to comply with the standards. And getting an accreditation for insurance purposes, no. That is not the thing. It is for the hospital safety, it is for the patient safety, as well as the clinicians and our health workers' safety. The thing is that the thing of insurances, or you think of this particular our accreditation processes, we ourselves should feel whether we can take our relatives, our close relatives to that particular institution where we are working, and we should be damn sure that our quality is at par standard so that we can take them for any services. So please try to understand, insurance is not the thing for the quality. For insurance is not at all a criteria to bring an accreditation. Quality, patient safety and staff safety is the main thing. For that, which you need to have an hospital infection control to be very good. Your staffing and staff training should be, should be always in a continuous process, so that the quality should be maintained. So all these processes together brings you quality, not the standard books or some NABH inspection. So continuous process of these things will bring you continuous quality. Statutory requirements, as say, any assessor comes to your institutions, the thing which he can tell you or give you assurances, that will be an NC if statutory requirements is not found. Law of land has to be strictly followed. And now the Clinical Establishment Act is on the thing. Now I think the assessors may ask you, but there are a lot of legal implications now. You can say that it is in the court, and you can give the evidences which we have the court order, especially QPMBA, KPHA, everybody has got it from the court. So legal statutory requirements is a must, and we have to adhere with that. Another thing is staff welfare. So as we said, as a unit, if any institution has to go out and work together, be as a team, the staff should be satisfied. And it's a minimal requirement, even if you take that national policy for employees, we have to maintain some minimal thing for the staff, like staff welfare programs, their health and staff development, everything. That has to be at least for our own members of the family. Whatever we do, we should do for our staff also. So these are some myths which came to my mind. I just noted it, and some realities I have told you. So I think they have given me 15 minutes. I have spoke for 10 minutes, another 5 minutes. If anybody wants to ask, please ask. Whatever I can, I will tell you. Thank you. Any questions? Our Clinical Establishment Act. Okay. Clinical Establishment Act already passed in Lok Sabha, but our Niyamasabha, our Kerala state, rules ellam aayittundu, but still our bodies like IMA, KPHA, QPMP, they have asked for an amendments, or still it is in already the temporary registration has been started. I think last day has gone, no sir? Last day is over. They are planning to impose fine for that. And CEA, District Registrating Authority, I am a member. Only 5 members are there. One is collector, second is DMO, third is from 3 organizations that I am the one member of that District Registration Authority. And I am the only one member who is there and strictly opposing that inside that. So what we are asking in the meeting is, see, let's all be, the amendment has to be brought in. Especially many clauses of that particular bill is very much problematic. That is the honor of somebody coming to your institution with some cardiac arrest or something, that transporting him to a better facility and all for example, I am telling you, so each and every emergency, the honor of protecting or transferring that particular person is on the one-day doctor or one doctor institution, or say 5-day doctor or particular 10-bedded institution. So every doctor has the honor to transport him whenever an emergency comes. These are one of few rules which we are opposing. So still the talks are going around. If the amendment comes, it will be well and good. Till now, IMA has not very positive regarding registration in CEA. Some institution from 6 months before, 6 institutions in Trivandrum has registered. I can't reveal the name. Thank you. Any other thing?
So there was a 30-number point where you told about the signages can be an eyewash.
Okay.
There is a particular point in the NADA which shows that the signages are a must for the organization.
Signages should not be eyewash. That is for the myths I am telling you. It's a myth that signages are just for eyewash. No. With a 6 feet tall myself, when I go for inspection, most probably I will be having this facility management rounds. I have to climb up to the terrace, all the things. Whatever the big institution it is, 6th floor and the terrace will be so crowded, the height will come down. The 6 feet fellow has to just walk down like kumbittu nadakendi varum. So the steps will be haphazard way. So anyway, if you properly give the signages of each and everything, that will be always best for the institution as well as the safety of the patients. That's what it means. It's a myth that signages are eyewash. No, it is not. It is for the institution. Anything else? Thank you.